Hey guys! So it is current me doing an intro for past me. I shot this video before my transplant, but I just didn't have time to edit and upload it. I was so busy getting packed and getting all of my things in order, and then when I was in the hospital I couldn't keep my eyes open, never mind, edit and upload. So I am doing that today, and I'm really proud of this video. I know it is really late, but I think it's really important video for me to make and for people to see, because I include a lot of really important information, and I hope it can help someone else. I know it is really long, but please stick around and please share it with your friends. I go over a whole lot of different information, and you never know when someone else could need it. So yeah, I'm really proud of it. I hope you guys like it. So thanks for watching. I'll see you in the past. Hey guys, it's Nicole. Welcome back to my channel, or if you're new here and haven't seen any of my videos before, I'm so happy to have you. Thanks for watching. Today I'm going to be going over what an allogeneic stem cell transplant is. We're going to go over what it is, what some of the risks are, what the process, and why I'm having one myself. So let's get right into it. Alright, so first of all, what is an allogeneic stem cell transplant? It's a treatment used to treat people with blood diseases such as non-Hodgkin's lymphoma, Hodgkin's lymphoma, leukemia, and multiple myeloma. It involves the transfer of stem cells from a healthy donor into your own body, either after high-intensity chemo and or total body irradiation. And it transfers not only just these stem cells, but the donor's blood system and immune system to you as well. So basically your donor's immune system becomes your immune system, and that is how your body helps to fight any cancer in the future, as well as get rid of the cancer you currently have. They are used to cure patients who are at a high risk of relapse, who haven't responded to treatment, or have relapsed after a prior transplant. So what are some of the risks of the treatment? Some of the risks include the immune rejection of the cells, which is called the graft versus host effect. And this happens when your immune system just rejects the new stem cells, and they never really engraft into your body. So when that happens, usually they will get another dose of stem cells from your donor and just try again until they do take. Some of the other risks are the immune reaction to the stem cells, which is called graft versus host disease. So what graft versus host disease is when your new cells attack your normal body tissues instead of the cancer. And so it's basically your new cells come in and they start attacking normal body tissue and your organs and stuff like that. And this can be anywhere from mild to really life-threatening. So you really have to watch for this. Luckily, they do have treatments for it. They'll put you on antibiotics usually, and help calm it down. Some of the symptoms of graft versus host include rashes, blistering, fevers, nausea, vomiting, diarrhea, loss of appetite and dryness of the lungs. So you really need to watch out for any of these symptoms while you're in the hospital and let your nurses know immediately. There are also two different kinds of graft versus host disease. There is either acute, which means it happens within 3 months of your transplant, or it can be chronic, and this can happen up to a year to 3 years afterwards. And you can have one or the other, or you could get both. It really depends on your body and how well you handle the new cells. Some of the other risks include the risks from doing total body irradiation to get rid of the cancer. Some of the risks are more mild, such as hair loss, mouth sores, most normal chemotherapy things like, sickness, nausea, the usual. Or they can be as severe as things like inflammation of the lungs or the sac around the heart, cataracts, and even sterility and more cancers. So if you are going to receive total body irradiation, it's only because your doctors have assessed that the benefits of the radiation outweigh the risks. Are you gonna tell them about the process, or should I? So what is the process of an allotransplant? How does it start? What do you do during it? How's it going to go? So to start off with, when you decide that you're going to have the transplant, first for a donor, they will look for a related donor. So this usually means a full blood sibling. Unfortunately, I don't have a full blood sibling. I only have a half sister, so at the most she would probably be a quarter match, which isn't high enough for the transplant. Other times they can look at parents or children, but really the best chance you usually have is a sibling. So when they're trying to find your donor match, they use tissue proteins called human leukocyte antigens, or HLAs, and they use these to find the match, and the closer the match, the better chance you have of the transplant working. Luckily, we have found me both a 10 out of 10 match, who will be my donor, and then for a backup donor, just in case, God forbid, anything happens, my other backup match is a 9 out of 10 match. So I am really lucky we were able to find a match. So because I didn't have a related donor, the way we found my donor was I went into this system called the One Match system. It's an international system, and both donors and patients go in, and then they use your HLAs to find your match. And your match could be someone from, your own community, or it could be someone from across the world. And of course, because of privacy laws, the donor is kept anonymous, although depending on where they're from and where you're from, you can usually request to find out who they are or a year or 2 years afterwards. So once they find your donor match, the process goes pretty quickly in most cases. First, you start off with doing blood work to make sure you're healthy. You go to different appointments to see different doctors. They have to clear you for dentistry, make sure your teeth are all good. You have to see an eye doctor. You have to go see a gynecologist if you're a woman. I don't know what happens if you're a guy. I don't know. But anyway, so yeah, you go to all of those pre-appointments, do a bunch of tests, and then you just wait for your transplant. So on December 29th, I go into the hospital to get my CVC line put in. I have a bunch of scars up here from my last one because I had a auto stem cell transplant a couple years ago, which I could do a video on sometime as well if you'd like. But yeah, so they're gonna put my CVC line in, and then I'm gonna come home for the weekend, and then on January 1st I go into the hospital and we do our high dose chemo that day. Then for the next couple days I get injections of a drug called AGT, and it is a modified rabbit genetic thing. I don't know how to explain it, but it's used to help suppress your immune system and to help with the effects of the new stem cells and help with them not being rejected. So we do those injections for a couple days. Then on January 3rd, we are doing the total body irradiation. So I'll be laying in the radiation tube kind of thing for I think an hour on my back and then an hour on my stomach. And we will radiate the whole body. Hopefully between the chemo and the radiation, it will kill my cancer, and then we will be set up good for the transplant, which the actual transplant will be happening on January 4th. So what the transplant involves is for a couple days before the transplant, the donor will be receiving a couple shots called GCSF shots, which basically stimulate stem cell production in their bone marrow and releases it into their bloodstream. And then on transplant day, they will be hooked up to an apheresis machine, and they'll be hooked up by IV. Their blood will go through the machine. It'll separate out white blood cells and platelets, and then it will return both their blood and their plasma to them, so they're really not losing any blood themselves, just the white blood cells and platelets. And once the stem cells have been collected from the donor, they will come right on over to my room for the actual transfusion, and I believe the transfusion just takes an hour or two. It really depends on how much you're receiving. So we shall see how long it takes. Hopefully not too long. But basically, yeah, they just hang it up like a normal blood transfusion. They'll hook me up by my CVC. I'll just receive the stem cells, and basically that'll be it for the day. So after the actual transplant, for the first 4 or 5 days afterwards, I should be feeling pretty good. The immune suppressant drugs probably won't have kicked in yet, so I'll be feeling okay, and I'll most likely get a lot of day passes and maybe even a couple night passes, so I can come home and relax here. But after the 4 or 5 day mark, I will start kind of like crashing. The immune suppressants will hit, so my immune system will be basically non-existent while the new one takes over. And so I'll spend the next month in the hospital trying not to get any infections, trying not to get graft versus host disease, basically trying not to die while we rebuild my new immune system. So that'll be lots of fun. So this is a pretty big procedure. It has a really long recovery time. The first 3 months afterwards, I need a full-time caretaker to help look after me because I won't be able to do much cooking. I can't go out in public and be around germs, and I can't be around big crowds or anything, so I'm gonna need someone to help around the house and take care of me. And then the full recovery time is about a year, and it does have some pretty big risks attached to it. So in case anyone is wondering why I'm going to be having such a risky procedure, Basically, the reason is because I've done 3 different types of chemo. I've had radiation, I've already had a stem cell transplant, and nothing has worked to even get me into remission, never mind cure me, and this procedure has the highest chance to cure me after this. So as risky as it is, like, if everything works out, I could spend the rest of my life cancer-free. So I think that outweighs the risks. And then once I'm cured, I can start moving on with my life. I can go back to work, I could go back to school, I can start doing more things I want to do and not have to worry about scheduling my life around chemo and treatments and being tired and sick all the time. And you know, I want to really experience life again. Like, I feel like my life has been on hold for the past 2 years, and you know, there were a couple times like I've been told I wasn't going to make it. So you know, it really means a lot to me that I could be living long enough to get married and see my nieces grow up and all of that stuff. So I'm really excited for that. But I mean, I would be lying if I said I wasn't scared, because I'm completely terrified, honestly. I'm afraid of it not working, I'm afraid of getting graft versus host, I'm afraid of dying, whether it be from cancer or from the procedure. And like, I feel like I've been kind of like traumatized by none of my other treatments working. So I really need this one to work. So I could use all of the prayers, all of the good vibes, all of the anything you're all willing to send me. I'm excited, I'm ready to do this, and I'm gonna take you all along with me. I'm gonna be vlogging as much as I can. You know, a lot of the actual procedures I won't be able to film, like getting my CVC in. I doubt they're gonna let me vlog, like, oh, they're just cutting me open. But I will try and vlog as much as I can for you. Also guys, at the end of this video, I'll be letting you guys know how you can kind of get involved yourselves and become a donor if you'd like. So all of that information will be at the end of the video, and I'll also include some links down below for you to check out. So I hope you enjoyed the video, guys. Let's go. So I also wanted to let you guys know a couple ways you can get involved yourselves, and maybe if this has inspired you to become a donor, that would, you know, really mean a lot to me, as well as so many patients throughout the world who are waiting for their matches as well. So basically, if you're Canadian, you can go to the Canada Blood site, and you can sign up online to become a donor, and you'll put in your information. They will send you a swab for you to take a cheek swab and then send in, and they will let you know if you're fit to be a donor or not. And then you will go into the system, and they will let you know if a match ever comes up for you. To become a stem cell donor in Canada, you have to be between the ages of 17 and 35 and have no history of cancer before. So there's that. I don't know what the standards are in the US, but I will leave the link to some information down below about it. Yeah, if you guys could become donors, you could help so many people in the world. And yeah, so check it out down below. So thank you guys so much for watching this video. I know it was pretty long, but thanks for hanging in with me. If you liked it, please give me a big old thumbs up. Subscribe if you haven't already and you want to see more of my videos. And if you want to you know, see a little more of my personal life between videos, all of my social media will be linked down below. And please, please, please guys, share this video. Share it with your friends, share it with your family, because you never know when someone else is going to need some of this information. And I hope it helps other people who are going to go through the transplant or are considering it. So yeah, thanks for watching guys. I will see you later. Bye!